Welcome. Today we're diving deep into the world of cardiology to understand a common heart condition, bicuspid aortic valve, or BAV. This condition, present from birth, affects the structure of the aortic valve, the gateway between your heart and the aorta, the main artery carrying blood to your body. Join us as we explore its causes, effects, diagnosis, and management. So, what causes a bicuspid aortic valve? Essentially, it's a congenital heart defect, meaning it's present at birth. Instead of having the usual 3 leaflets or cusps that make up a normal aortic valve, a bicuspid aortic valve has only 2. The exact reasons why this happens are not fully understood, but genetic factors are believed to play a significant role. It often runs in families, suggesting a hereditary component. While specific gene mutations haven't been definitively identified for every case, research is ongoing to pinpoint the specific genetic markers involved in BAV development. Now let's talk about what happens when the aortic valve isn't functioning as it should. The aortic valve's job is to open and close tightly, ensuring blood flows in one direction from the heart into the aorta. In a bicuspid aortic valve, this process can be compromised. Over time, the abnormal valve can become either stenotic, meaning it doesn't open fully, restricting blood flow and forcing the heart to work harder, or regurgitant, meaning it doesn't close properly, allowing blood to leak back into the heart. Both stenosis and regurgitation can lead to heart failure, enlargement of the aorta, and other serious complications if left untreated. The abnormal flow patterns across the valve can also damage the valve itself, accelerating its deterioration. Bicuspid aortic valve is the most common congenital heart defect, affecting approximately 1 to 2% of the population. It's more prevalent in males than females. Because it's a congenital condition, it's present across all ethnicities and geographic locations. However, due to its often asymptomatic nature, many individuals may not be diagnosed until adulthood, if at all. In many cases, individuals with a bicuspid aortic valve may not experience any noticeable symptoms for many years. However, as the valve dysfunction progresses, symptoms may begin to appear. These can include shortness of breath, especially during exertion, chest pain or tightness, fatigue, lightheadedness or dizziness, fainting, and a heart murmur that a doctor can hear during a routine examination. It's important to note that the severity of symptoms can vary widely depending on the degree of valve stenosis or regurgitation. Diagnosis of a bicuspid aortic valve typically involves a combination of physical examination and diagnostic tests. A doctor may first suspect BAV upon hearing a heart murmur during a physical exam. An echocardiogram, which uses sound waves to create images of the heart, is the primary diagnostic tool. It allows doctors to visualize the valve structure and assess its function, identifying stenosis or regurgitation. Other tests, such as an electrocardiogram, ECG to check heart rhythm, and MRI or CT scan to visualize the aorta, may also be performed, especially if aortic enlargement is suspected. While there aren't distinct types of bicuspid aortic valve in the same way you might classify cancers, there are variations in how the 2 valve leaflets fuse. The most common fusion pattern is between the right and left coronary cusps. The location of the fusion can influence the specific type of valve dysfunction and the risk of associated aortic complications. Treatment and management depend on the severity of the valve dysfunction and the presence of symptoms. Mild cases may only require regular monitoring with echocardiograms to track the valve's condition. As the valve dysfunction worsens, medical management with medications to control blood pressure and heart failure symptoms may be necessary. Ultimately, if stenosis or regurgitation becomes severe, surgical intervention may be required. This could involve valve repair, where the existing valve is reconstructed, or valve replacement, where the damaged valve is replaced with a mechanical or biological valve. Transcatheter aortic valve replacement, or TAVR, is a less invasive option for some patients, where a new valve is inserted through a catheter. Unfortunately, there's no definitive way to prevent a bicuspid aortic valve since it's a congenital condition. However, if you have a family history of heart defects, genetic counseling may be beneficial before planning a pregnancy. Early detection and regular monitoring are crucial for managing the condition and preventing complications. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can also help support overall cardiovascular health. The prognosis for individuals with a bicuspid aortic valve varies depending on the severity of the valve dysfunction and the presence of other health conditions. With regular monitoring and appropriate treatment, many individuals can lead long and healthy lives. However, it's important to be aware of the potential for complications, such as aortic stenosis, aortic regurgitation, endocarditis, infection of the heart valve, and aortic dissection. Ongoing research is focused on improving diagnostic techniques, developing less invasive treatment options, and understanding the genetic basis of BV to identify individuals at higher risk and develop targeted prevention strategies. For example, research into biomarkers that predict valve deterioration is ongoing, as is research into better surgical techniques for valve repair. These advances aim to improve the long-term outcomes for individuals with bicuspid aortic valve.